Most of my male patients come in with three concerns: penile length, thickness, or performance. But what's interesting is these concerns are rarely new. They have been usually there for years, just never discussed openly. Last month, we spoke about female sexual rejuvenation. Today, let's understand its counterpart, that is male sexual rejuvenation. Now, before we get into the treatments, there's one thing I always clarify in the first consultation. Some of these concerns are cosmetic and some are actual medical conditions. And unless you understand that difference, you will either overtreat something that doesn't need intervention or ignore something that actually requires some medical attention. Let's start with length because that's the most common concern. Scientifically, the average erect penile length is around 5 to 6 inches. Now, this number is important because most men who come in worried about size are actually within this normal range. The problem is not always anatomy, it's comparison and perception. Flaccid size, especially, is highly variable. It changes with temperature, anxiety, even room environment. So, judging size based on flaccid appearance is medically inaccurate but very common psychologically. Now, from an anatomical perspective, a part of the penis is actually internal, anchored to the pubic bone by the suspensory ligament. This is where penile lengthening surgery comes in. When we release this ligament, a portion of the internal shaft it becomes externally visible. But here's the key point patients often misunderstand. This increases visible flaccid length, not the actual erectile length, because erection depends on blood-filled tissue expansion, not ligament positioning. So, if expectations are not set correctly, this procedure can feel disappointing even if technically successful. There's also a rare condition called micropenis, usually due to hormonal issues during development. Now, that's not a cosmetic concern, that's a medical diagnosis and it needs proper endocrine evaluation, not just surgery. Now, let's talk about girth or thickness. Average erect penile girth is around 4.5 to 5 inches, and like length, it varies naturally. But unlike length, the girth is more directly linked to the volume capacity of the erectile tissues, the corpora cavernosa. So, when blood fills these chambers, they expand not just in length but also in width. So, if blood flow is normal, girth expansion is naturally adequate in most individuals, which is why true medical deficiency in girth is actually uncommon. Most concerns here are again perception based or related to surrounding fat in the pubic area, which can visually reduce the exposed shaft. Now, when we do consider girth enhancement, there are two main approaches. One is fat grafting, where fat is harvested from another area and injected. The advantage here is biocompatibility. It's your own tissue, but biologically, not all fat survives. Typically, a percentage of it gets reabsorbed over time, which means results may reduce or it may require repeat sessions. The second option is dermal fillers, which allows more precise and uniform contouring, but these are temporary and need maintenance over time. So again, this is not a one-time permanent transformation, it's a managed outcome. Now coming to the third and the most complex concern, that is performance, because this is where most patients misunderstand the problem. An erection is not just a physical structure issue, it's a neurovascular event. Your brain initiates arousal, nerves carry that signal, blood vessels dilate, and the blood fills the corpora cavernosa. At the same time, venous outflow is also restricted, so the blood stays trapped, creating rigidity. So, for a normal erection, you need healthy blood vessels, intact nerve pathways, and balanced hormones, especially testosterone. Now, if any of these is affected, you can experience erectile dysfunction. And today, we are seeing this more in younger patients as well, not because of aging, but because of lifestyle and systemic health. Diabetes damages the small blood vessels, hypertension affects the vascular elasticity, and smoking reduces blood flow. Also, chronic stress affects neural signaling. Even excessive digital stimulation through porn can alter how the brain responds to the real life stimuli. So, in many cases, this is not a surgical problem, it's a medical and a lifestyle issue. Now, where does something like the P shot fit in this? So, PRP or platelet rich plasma is derived from your own blood. It contains growth factors that help with tissue repair and angiogenesis, meaning new blood vessel formation. The idea is to improve the local tissue quality and potentially enhance blood flow response. But this is where clarity is important. PRP does not fix severe vascular disease. It does not correct hormonal imbalance. So it works best in early or mild dysfunction or as a supportive therapy, not a primary solution. Now, in severe cases of erectile dysfunction where medications and other treatments fail, we consider penile implant surgery. This involves placing an inflatable or a semi-rigid device within the erectile chambers. So, inflatable implants are the most commonly used, allowing the patient to create an erection on demand and return to a flaccid state after. It does not increase size or sensation, it restores the functional rigidity. Satisfaction rates are very high in the right patient. And that's the key takeaway. Male sexual rejuvenation is not just about size or performance. It's about understanding whether the concern is cosmetic or medical and choosing the right treatment for the right reason. If you found this information useful, like this video and subscribe to the channel for more medically honest plastic surgery discussions.